poverty as a social determinant of health and try to do that in a fairly short period of time because there's a lot that we could go over. And it's really good timing too because we're going to be doing a poverty simulation for the first year medicine and pharmacy students in the fall. We'll actually be doing it 4 times because that's how many times it'll take to capture all of our students. But this has helped me have a very quick reason to pull some of the stats together in preparation for that. So learning objectives, it actually ties really nicely into some of the ICANN learning objectives overall to conduct a holistic biopsychosocial assessment of patients, integrating physical, mental, and emotional aspects of health and wellness, and integrate relevant social determinants of health into the evaluation of patients and communities. So Healthy People 2020 identified 5 key areas of social determinants of health. And as a just quick reminder, social determinants of health are those conditions where people are born, live, work, play, age, learn, all of those conditions in which we're born that affect a wide range of our health and quality of life. So conditions in the health environments or places, also the patterns of social engagement, the sense of security and well-being, all of which can actually impact our population health outcomes. The World Health Organization identifies poverty as the single largest determinant of health, noting that poorer people have shorter lives and poorer health in comparison to more affluent people. And it's such a huge disparity that it's drawn the attention really globally. So the way that the U.S. government looks at poverty, they look at it 2 different ways. This would be the poverty threshold. So it's the number of people, and it's updated annually by the Census Bureau, but an estimate of the number of individuals living in poverty each year. So you'll see that the median income nationally is about almost $58,000. The average income, though, is about $31,000. Interestingly, for Ohio, the average income is about $29,000. Nationally, our poverty rate is 12.3%, and Ohio, our population, we have 14% in poverty. That's a little different than the poverty guidelines, which are based off of the poverty thresholds that are used for administrative purposes to help determine if people would be eligible for certain programs. So I think it's interesting to note that the average income in Ohio was $29,000, but you don't really get considered to be in poverty if you're living alone until you're only making $12,000 a year. But a family of 5 would already be considered within poverty. So when you think about that versus what it costs to afford basic necessities, I mean, it's a little different. So if you're making $19,000 a year, that's just enough to cover the household budget for somebody in Ohio on average. And these numbers are a little off, but it really helps to take a look at what that means. So regardless of what you make, the actual expenses to exist and at a very basic level are pretty high. And when you look at it, in comparison to all of the income levels, those people who are in the most deep levels of poverty, the disparity between the cost of their basic necessities and their after-tax income is enormous. So this is why things become so problematic, because people cannot even begin to afford their basic necessities like food, clothing, shelter, healthcare costs. An interesting thing that I found recently is an organization called United for Alice, and what they've started looking at is, ALICE is an acronym for Asset Limited, Income Constrained, and Employed. So it describes those individuals who don't fall within poverty guidelines to be eligible for assistance, and they don't fall beneath the poverty threshold, but they also don't earn enough income within their household to maintain a fair budget. And because they don't fall under the poverty guidelines, they also don't qualify for assistance. So these are the households that struggle to maintain their most basic needs, and any kind of short-term decision that they make will have an immediate pressing need is inevitably going to have long-term consequences. And these low-income families wouldn't even technically be considered low income. So ALICE families, even worse for lower income families, are especially sensitive to any kind of out-of-pocket increased cost. So Ohio is kind of an interesting thing to look at, and there's this great podcast that looks at poverty myths, and they look very specifically at Ohio because Ohio has an interesting flavor of poverty. You have Cleveland as an example of very urban poverty. You have Appalachia as an example of very rural poverty. And then you have what's called very often the Rust Belt, so the Youngstown area, where there had not been a lot of poverty, but there has been since the closing of steel mills in that industry. And so the number of households in Ohio is a little over 4 million. Our poverty rate is 14%. Our ALICE percentage is actually almost 30% of Ohio falls within that ALICE category. And 50% of the state falls above, less than 50% falls above the ALICE category. So where 40% of the US is falling below the ALICE threshold, there's some pretty serious consequences for that. And that's really where it gets into the social determinants of health, or how this becomes a social determinant of health. So the larger the gap between income and expenses, the more extreme the decisions are and the greater the risk to a family's immediate safety, health, and financial stability. And when you look at a household budget, all of these areas fall within in a typical scenario. So health and healthcare, housing, childcare and education, food, taxes, transportation, and technology. And a choice in one area will lead to all kinds of problems or impact all of the other areas, demonstrating how complicated and interwoven these financial decisions become. So looking specifically at poverty and health, because we are an ECHO program focused on the integration of mental and physical health, poor health can be both a cause and a consequence of financial instability. If we think about it, and we've all seen this, one illness or emergency can force a family into poverty. You're more likely to become ill, and because if your basic needs aren't being met, or if you are not able to get insurance coverage or quality preventive care. There's also more difficulty in recovering from illnesses, both physically and financially, if you're in poverty. And issues in any of these areas can lead to chronic stress, which is especially risky for young individuals because of exposure to adverse childhood events, which we already know increase your risk for a variety of negative health and mental health outcomes. So this figure looks at and compares 4 monthly budgets, healthcare budgets for a family of 4, compared to the average monthly salary of a full-time nursing assistant. And they use this figure because in 2017, 1.4 million ALICE workers across the United States had a healthcare support job and earned an average of $13 an hour, which comes out to about $26,000 a year. So well below what a standard ALICE household would pull in and below the average Ohio household. What do families do if they can't afford healthcare? Well, when health issues go untreated, we know that they could potentially become worse problems or additional new problems. Young children below the federal poverty level are less likely than those in higher income families to receive scheduled vaccines. Adults, 14 to 20%, low income adults are 14 to 26% less likely to receive regular screenings. Half of the adults and 60% of seniors with lower incomes did not regularly visit a dentist. And 1 in 4 uninsured adults don't visit the dentist because of out-of-pocket costs. And poor oral health can lead to pain, of course, but also can inevitably lead to poor nutrition, diabetes, heart disease, and a slew of other medical conditions. We really do need to get more on oral health into all of our programming, I think. Beyond that, delaying or foregoing care can reduce school attendance or work attendance and overall quality of life. So health issues account for half or more of all school absences, with asthma and poor oral health being the leading causes. And 1/3 of unscheduled absences from work result in lost wages for employees and reduced productivity for employers. People who can't afford health insurance often go without mental health care. So untreated mental illness in children and teens has severe social and educational consequences, in addition to the untreated mental illness in any age range. 50% of children with a mental health condition actually received treatment in 2017. 37% of the students with mental health conditions at age 14 ended up dropping out of school, and 70% of youth in the juvenile justice system have some type of mental health condition. Families who are unable to afford health care might try to find affordable health insurance, which is not an easy thing to do. Certainly if you're under 100% of the poverty limit, your ability to get employer-sponsored coverage is pretty low. So the farther away you are from poverty, the more likely you are to get employer-sponsored coverage. But the more poor you are, the less likely that is. So really creating a huge gap for individuals who don't qualify for Medicaid, and why Medicaid expansion was so important. Families who can't afford health insurance might even try to move to a healthier community. In a huge study, they looked at across the US, they found that 25% of the diseases included in the study were influenced primarily by the environment. So this is your natural environment and your built environment. Social and economic factors, education, employment, income, the characteristics of the environment, which would be housing and air quality and water, and proximity to healthcare, all impact your healthcare outcomes. Families who do end up moving to a community that they perceive to be healthier inevitably have a decrease in social support. So they move, they're leaving a social network behind. Sometimes social networks are difficult to build back up, particularly if you don't have family in the area. And social support, we know, protects people from physical and mental health risks. Without it, people are at an increased risk of poor health and more likely to experience stress, potentially chronic stress, and engage in a variety of unhealthy behaviors. The way that I formatted my slides is driving Jamie crazy right now. Tough decisions that Alice households and low-income households make also impact the broader community. And the broader community impacts those households. I think that this is important to understand because we tend to think of poverty as an individual level thing, and it's really not. You might be an Alice family, but if you're living in an impoverished community, the resources that you might have access to in a different community might not be there at all. So being able to access, transportation, safe places for exercise and leisure, good schools, all of those things that a wealthier community provides, a more impoverished community might not have. So even at the individual level, you might continue to better yourself, but only be able to get so far because of the community that you live within. So these are the variety of my references, but United for Alice is a very cool organization. That's why I used a lot of stuff from them. They're a grassroots movement that pulled together the United Ways from Arkansas, Connecticut, Florida, whole list of states, including Ohio, though, to try to take a look at that group that's really falling short, that we're all falling short and forgetting about. Not that people in deep poverty aren't forgotten about, because they definitely are, but there's this whole other income bracket of individuals that is suffering some of this same social determinants of health from poverty, even though they don't technically classify as living in poverty. So I